Welcome to another Dr. G Health Mastery series. We're going to talk about osteoporosis and fragility fractures today. This series is going to be extremely helpful if you're a postmenopausal woman of any age, you're a man over 50, or you suffer from certain chronic health conditions that require long-term medications. My name is Dr. Ahmed Kamara of Dr. To. As usual, please use this as information only, but discuss your symptoms and management plan or medications with your primary physician. Let's talk about what osteoporosis is. So osteoporosis is the progressive reduction of bone mass and deterioration of the structure of bone that eventually leads to the bone density becoming so reduced that the density is below 2.5 standard deviation away from the mean of peak bone mass. And this is usually measured using something called a DEXA scan or dual energy X-ray absorptiometry scan, and it's reported as T-scores. So a T-score of minus 2.5 or less will characterize one as having osteoporosis. The concern when someone has osteoporosis is the risk of having an osteoporotic fracture. An osteoporotic fracture is called a fragility fracture. And this is really a fracture that happens as a result of significantly reduced bone density. Now, anyone can develop a fracture if you fall from a height, or if you have a high impact blow such as a road traffic accident, will lead to a fracture. However, a fragility fracture is when someone suffers a fracture falling from a standing height or below. Or in some cases actually, a fall doesn't even happen. The fracture may just develop spontaneously, as is often the case with osteoporotic fractures that happen in the spine, so in your vertebrae. These so-called spontaneous fractures would usually happen when you're perhaps just bending or lifting something that you wouldn't normally expect to cause a fracture, nothing particularly heavy. So I really want to emphasize again, the issue with osteoporosis isn't the fact that you have reduced bone mineral density. It is your risk of developing a fracture without significant trauma or without falling from a height. In England and Wales, approximately 180,000 fractures happen every year that are due to osteoporosis or osteoporotic fracture. Incidence in women is about 1 in 3. The incidence in men is about 1 in 5. So women are significantly more at risk, especially after the menopause, when there is a significant decline in bone mineral density. In the absence of a fracture that is later found to be osteoporotic fracture, people will actually live with osteoporosis for many years without any symptoms. So sadly, the symptom may only be recognized the very first time that someone develops a fracture. Osteoporotic fractures tend to affect the wrist. Perhaps you fall and you put your hands out to break the fall. Your hips. Hip fractures are one of the most significant fractures you can have. The prognosis following a hip fracture isn't very good. In fact, most of the patients who survive an emergency total hip replacement, approximately 60% of them do not survive beyond a year after discharge from hospital. So it is a really important subject, and it's really important to know what you can do to protect your bones so that you don't get severe osteoporosis. Osteoporosis develops because bone is constantly being remodeled, and that is, you have cells that are building bone structure and bone mass, and you have cells that are reducing bone structure and causing a deterioration in bone mass. So the ones who build bone structure are cells called osteoblasts, okay? And the ones who reduce bone structure or reduce the density are called osteoclasts. And so if you have an imbalance of osteoblasts building bone and osteoclasts such that the osteoclastic activity is so much more than the osteoblastic activity, this can over a period of time result in the reduction in bone composition, bone structure, and the size of the bone itself, leading to osteoporosis. On average, peak bone density tends to occur in the third decade of life. But there are various factors that can affect when precisely this happens. And these are really, really important to bear in mind. Some you can do something about, some you can't. So for example, our genetics play a role in that, and there's nothing we can do about our genetics. But our nutrition, especially our consumption of calcium and vitamin D, play an important role in the strength and density of our bones. Our levels of activities as well. So if you're more physically active, that really helps the strength of your bones. Other things that are important are medications that you're exposed to, which is what I mentioned, certain chronic illnesses earlier. And these include, for example, illnesses that require you to be on long-term steroids, so autoimmune conditions, chronic inflammatory conditions, sex hormones such as the amount of testosterone and estrogen that we have circulating within us also contributes to when we develop osteoporosis. And that is why women who are postmenopausal, and when a woman goes into the menopause, their ovaries essentially stop ovulating, and so the amount of circulating estrogen in their blood is significantly less, and this leads to an accelerated reduction in bone density and progression towards osteoporosis. The same thing also happens in older men, as the amount of testosterone a man produces significantly reduces, usually beyond the age of 50, but again it varies from man to man. So that was a quick tour of osteoporosis and fragility fracture, hinting at some of the factors that can negatively impact on the strength of your bone, or positively impact depending on what you do with it. For example, having a good nutrition, consuming sufficient calcium and vitamin D in the diet, being more physically active can also help. We do have other videos, for example, on assessing the risk of fragility fractures, and that is really, really important because osteoporosis doesn't have symptoms. But if you know that you're high risk, or your doctor is able to tell you that you're high risk, you can take measures or even go on to have your bone density measured. We also have another video on the management, the treatment of osteoporosis, and some of the side effects to look out for and how to avoid them. Well, until next time, I hope you look after yourself, be a master of your health, and see you soon.